Good morning, everyone. Thanks again for coming back. Okay, so I'm not quite starting shift yet, just getting some homework, I suppose, done with my AMP. Trying to get the idea about heart and a bit more under my belt, because I keep forgetting things, so why not start now? Yesterday had 5 Cat 1 calls, which were the most urgent of all calls. We had a DOA in the morning, which was quite sad, at a care home, and that took about 2 hours of paperwork, etc. The day beforehand, I went to a cardiac arrest again. We had the lady who had just collapsed in her bathroom. Her husband was there. She let out a bark, apparently, and she went to the floor, and we arrived, I think, within about 4 minutes of the call, and we spent 45 minutes on this lady, but sadly it wasn't to be. But it was really, really good seeing 2 crews working together. So we had backup within about 2 minutes of another ambulance coming over, so another paramedic, another ECA coming to help us. So as soon as we went in, saw the lady on the floor, I jumped on the chest. My paramedic colleague did all what she was doing. I had to concentrate on what I was doing. And then we had a backup, and we basically swapped placements of CPR, bag valve mask, and then the paramedics were doing sorry, there's just a timeout thing. And they were doing the drugs. And sadly, the husband was there watching as well through the bathroom door. And every now and again, he would ask, how is she? Is she all right? And you would just have to acknowledge him saying, we're doing everything we can, knowing the fact that the longer we're doing this, the more likelihood is that she's actually dead. And, by the time we finished, she had a lot of cyanosis in her face, which is a lot of sort of discoloration where she was dead. Hypoxia, as in no oxygen, was evident, and we think she died of a PE, which was a pulmonary embolism, which is a blockage in your lung, from what I remember. But when we finished this, we finished the CPR, and when the paramedics called it. And we also were just sort of packing things away and placing this lady in a more presentable position in the bathroom. I was really surprised about how the husband was handling it, and he had his friend with him, and they were almost like joking and laughing, and I thought, how could you do that? I mean, I would be absolutely devastated, and beyond. Beyond comfort for if something happened to my family members. And then I thought, well, this is the way he's handling his grief. And, it's going to take a while for him to process the fact that that night he was going to bed on his own. And he'll see little things like slippers on the floor, and but everyone handles grief in a very personal and different way. So that was that one. And the day before then, I told you it was a busy time. We had a working fitter, or someone who was seizing all the time. Young male, 22-year-old. We went to see him. He's sitting on top of his, sitting on his chair. Was okay, but his eyes were quite vacant. So he's just like post-ictal or post seizure. And then he kept on going into fits with trismus, which means your teeth just don't open up, so he couldn't actually get anything in there. And he was choking on his vomit, so somehow we had to try and get this suction into his mouth, but not past his teeth to the point where it will bite his teeth. But we had a gap, so that was good. But yeah, he was blue lighted in. And that's what I was sort of learning about the diazepam, I think it is, correct me if I'm wrong, which is an anti-fitting or anti-seizing medication for epileptic and that sort of type of condition. So the last couple of days I've learnt a lot. Yeah, lots of experience, lots of different jobs to keep him on my toes. I'm on just starting day 3 of 4 of 6 a.m. to 4 p.m. I've been up since 4:15 this morning. That's when my alarm goes off. So not exactly bright-eyed and bushy-tailed again. Right, it'll be just about starting my shift soon. So okay, I will do another video for you as soon as possible. Keep well, stay safe, and keep watching, and thanks again for your subscriptions. Take care. Bye bye for now.